Do you dread every month when your period is right around the corner because you're waiting for the inevitable pain that might come? Or maybe you just think, well, my painful period is just part of who I am and part of being a woman because my mom or other women in my family also experience the same symptoms that I do. And so you're reaching for ibuprofen, you're reaching for that hot water bottle by the end of the night, trying to soothe those painful cramps away. Or maybe you find yourself in the bathroom a few days before or when you get your period because you have diarrhea. So not only is the painful period happening, but you have diarrhea on top of it. If this resonates with you, sounds like someone you might know, then you're in the right place today. Because today I'm going to talk about a reason why you might be having these painful periods. And these painful periods isn't something that you should be having and you don't have to live through it. We're going to find some ways to correct what might be happening. My name is Marcy Vasky, and I'm a functional medicine nutritionist. I specialize in gut health, so I work with a lot of people who have pain and discomfort in the way of constipation, diarrhea, bloating, gas, and that's just to name a few. But I also work with a lot of women who have hormone issues and period troubles every month. So if I'm talking to you and this resonates with you, then I've linked a link to our website where you can make an initial appointment with us and we can help you through the journey of either your gut health or even hormonal troubles that you might be experiencing. I've also linked a link for our 5 ways to improve gut health. And that's just a nice, easy step into, well, what can I take on myself before I might need some more help? Okay, so let's dig into this fun topic of hormones. And I really do love talking about hormones and periods because through my own journey and my own dysfunction with hormonal imbalance and countless clients that I've worked with, I'm always astounded about how much we don't even know about our own period. And so once you know some of the basics and maybe even a little more detail, you can understand your own body so much better. And, because I know when I was in school or, coming up on my period, I wasn't taught a lot. We did health class and they said, well, you're going to get your period, you'll ovulate halfway through, you might have some PMS symptoms, and then just kind of go about your way. But we don't really learn what happens every month precisely. And so today what I want to really dig into is just a painful period because so many women and girls are struggling with these painful periods month to month that either put them in bed or make them feel nauseous and sick. And if there's a way that we can help with that, that's what I want to do. And once you get your period, it really does change your life forever. And so we want to make it the best experience we can have instead of something that we dread every month. So as I said, today I want to discuss painful periods. And this is something that maybe you've asked yourself, why do I have so much pain with my period? And today I'm going to help you with the answer. Now, there's many reasons why we might be experiencing painful periods. So what we're going to dig in today is something called prostaglandins. And you might be thinking, what the heck are prostaglandins? Well, they are a hormone-like substance that's actually derived from a chemical called arachidonic acid. And they are one of a number of hormone-like substances in our body. And these prostaglandins participate in many different things in our body, such as contractions and relaxation of our smooth muscles, or dilation and constriction of our blood vessels. And they control our blood pressure, and they modulate inflammation. So now, even though they have the ability to make menstrual cramps worse, not all prostaglandin functions are bad. They're actually very necessary and protective. These necessary and protective prostaglandins are great unless we have too many of them. So what's good about prostaglandins? Well, I named them above, but just to dig in a bit more, prostaglandins will help an injured blood vessel. They are released at the site of the injury to help form a clot. And so your body can heal the damaged tissue. Prostaglandins also stimulate the contraction of the blood vessels and muscle tissue to prevent further bleeding from being lost. And so prostaglandins, hormones, are made nearly in every cell of our body. So now how do these prostaglandins work in the uterus? Well, they help the uterus to contract each month so that you can release the lining of your uterus, called the endometrium. And studies have shown that the more prostaglandin inflammation you have, the worse your menstrual cramps can be, which we call dysmenorrhea. And prostaglandins don't only just work in the uterus, but they also help in other areas of our menstrual cycle, such as by stimulating the ovulation process, as well as playing a role in pregnancy. Prostaglandins in pregnancy elevate during labor to stimulate the uterine contractions and then, of course, the birth of the baby. And since I am a gut health expert and that's the people I work with, and of course, I can't get through a whole video without talking about pooping, considering it is my area of expertise. Have you ever noticed that maybe you get loose stools or diarrhea the day before or maybe the first day of your period? And if it wasn't bad enough to have severe menstrual cramps, then you have diarrhea on top of it. Well, it is not fun, obviously. But diarrhea during your period is a sign that you have too many prostaglandins. So just as those prostaglandins affect our uterus and give cramping, they also affect the bowel. The prostaglandins actually stimulate the contracting and relaxation of muscles of the digestive tract. So, which is why your period can also cause those changes in bowels. So again, highlighting that if you have too many prostaglandins in your body, you'll have loose stool and those painful period cramps. So, okay, now we know how we have painful periods, but how do prostaglandins become high in our body in the first place? And of course, then what can we do to decrease them? So as I said earlier, prostaglandins are made from arachidonic acid. And this is when they're elevated in response to inflammation. And inflammation that can be caused by factors such as a poor diet, a diet rich in omega-6s, and not that we don't need those omega-6s, but they need to be balanced with proper omega-3s. And unfortunately, the standard American diet, or SAD diet as it's called, is very high in omega-6s and very low in omega-3s. So you can see how quickly that imbalance can happen and the inflammation begins and the prostaglandins become higher. And so once the distortion becomes distorted, excessive and chronic inflammation can occur, as I said. And chronic inflammation is where the problems like those painful periods begin. And in this case, those prostaglandins are elevated. So what are some examples of foods high in omega-6 fatty acids? Well, those are going to be things like damaged fats. And I talk about this all the time because they're everywhere and we don't realize it. Damaged fats are things like soybean oil, corn oil, vegetable oil, cottonseed oil. We want to stay far away from those for multiple reasons. Also, things that are high and rich in omega-6s are going to be fast food. And often those fast food items or takeout have been cooked in those damaged fats I just spoke about. Or possibly commercially raised poultry. And that is because they have those antibiotics or they have hormones that have been placed in meat. So we want to eliminate these poor food choices and really optimize that omega-6 to omega-3 balance to help reduce the inflammation in our body. And so besides eating a whole foods diet, rich in vegetables and proteins, carbohydrates, and healthy fats, we want to reduce the prostaglandins in our body. So how else can we do that? One way to increase or decrease rather prostaglandins is to actually increase magnesium. Now, magnesium has been shown to be more effective than a placebo in decreasing prostaglandins and actually easing menstrual cramping. Now, if you're a woman who already has loose stools, You want to be sure that you're not taking in magnesium citrate, because that will just make the problem even worse. And of course, we don't want that. So I typically recommend magnesium glycinate. It's the most absorbable form of magnesium, and the dose is usually 300 or 400 milligrams at night. And some women really find, benefit in actually increasing their dose right before their period, maybe 5 to 7 days leading up to their period, and then taking it during if they need to diminish some of that cramping. Another really natural way to decrease menstrual cramps is ginger. And there was actually a small study done that found that ginger was actually more effective than ibuprofen in relieving the menstrual cramps. And you would want to take in about 1,000 milligrams is just kind of a minimum dose to get some relief from those cramps. And so how can you do that? Well, you can, of course, take a supplement, or you can do some just daily things as you're kind of leading into the period. Maybe it's a few days before, as I said, during the cramping time, but just incorporate ginger into your food. Easy stir fries with some fresh shredded ginger in there, or maybe just brew yourself a cup of ginger tea and sip on it throughout the day. But if you're really having really severe menstrual cramps, you probably are going to want to take a supplement with that. Another way to reduce prostaglandins is to increase your fatty fish consumption. So those fish that are high in omega-3s like mackerel, salmon, sardines, and the reason for this is because omega-3s are extremely anti-inflammatory. So while prostaglandins can be made from omega-3s, the omega-3 versus the omega-6, where the 3s make a much lesser, like a less strong prostaglandin. Therefore, you don't get the period cramping as you do if you were taking in overabundance of omega-6s from, let's say, takeout or fast food. And the usual dose for omega-3s is about 1,500 milligrams a day. And if you're really struggling and suffering with those menstrual cramps, you might be up for the challenge of taking and eliminating dairy out of your diet for 30 days. Many women who have dairy sensitivities also struggle with severe menstrual cramping. And part of this is likely due to the fact that you're eating foods you are sensitive to, which naturally increases inflammation in the body. And inflammation in the body can also lead to further imbalance in your hormones, including one called estrogen dominance, which I am going to be discussing in another video later on. So when estrogen goes high, it creates a condition known as estrogen dominance, which can also contribute to this prostaglandin pain and other period problems. So one way to do this is take the dairy out for 30 days and make sure you're charting your symptoms and knowing your normal period cycle. Once you've had the dairy out for 30 days and you've had a period and you've charted it all down, then you can start reintroducing the dairy, and then of course charting that for 30 days to see if the period was more painful or had changed in any way. Now, like I said, make sure you go through the full cycle because that's where you get all the good data. And I feel it's just really important to remember that a healthy body has a healthy period. Our body is always trying to tell us something, either if we're feeling good or we're feeling bad. And sometimes we just don't pay attention to it. So start charting, start knowing your cycle, start seeing how foods interact with all of that, and save yourself some pain and listen to what your body is always trying to tell you.